This information is for those of you out there that see the potential of our human family to serve a sacred role as stewards, agents of regeneration, and as a keystone species, and you want to bring another human into this world and nurture them with that knowing. The path to redefining, or rather remembering the original blueprint for, humanity's sacred relationship and stewardship role with the living earth begins with each one of us from the inside out. After that transformation occurs, that pathway of metamorphosis and remembering is potentiated one growing vibrant, loving, empowered, ancestrally conscious, informed, hopeful, spiritually aligned, ecologically literate, compassionate, and courageous family at a time. Some humans might be scheming how to reduce your fertility rates, but unlike the anti-human UN Sustainable Development, and who One Health, technocrats, I see humans as having innate and immense potential to be a force for good, regeneration, and increasing biodiversity on the planet Earth. Thus, I have compiled this nutritional and herbal information to empower those of you that seek to engage in the sacred act of inviting a soul to come into this world, care for and protect them when their body is young, guide them to unfold their true potential, and nurture them to be capable of applying their unique gifts to make this world a better place. One of the best places to begin is making sure your body has all the building blocks required to make another human being manifest in the physical. There are many high-tech and lab-made /isolated products and procedures on the market in the realm of fertility. But for those of us that are capable of reproducing naturally, working with the molecules and stimulus nature gives us supports fertility in a holistic way. Fertility is natural, trust nature. Nutrition definitely has the potential to improve egg and sperm quality, encourage hormone balance, promote regular ovulation, and ultimately improve your chances of a healthy pregnancy. Addressing the misanthropic overpopulation propaganda. All the metrics we have show that fertility is plummeting worldwide. Propagandists that want to frame that trend in a positive or benign light will tell you that is driven by factors like increased access to education and employment for women, changing societal norms, and rising costs of raising children. But that story neglects to give you the full picture. In reality, there has been a concerted effort on the part of some eugenicists to actively poison the population on a massive scale, using a range of different vectors of attack, with the express intent of lowering fertility rates, and those involuntary eugenics operations are exacerbated by the trend of industrial pollutants of modern civilization finding their way into our water, food, and homes through apathetic corporations being driven by profits and not really caring whether their customers live or die. Globally, fertility rates are declining, with many countries now below the replacement level of 2.1 children per woman, meaning populations are not replacing themselves. The global TFR has more than halved over the past 70 years and plummeted exponentially in the last 4 years especially. If you're a millennial or a younger Gen Zer, you'll probably see the start of a long-term decline in human population due to the global collapse in fertility. That's something that's never happened before with Homo sapiens. Global fertility isn't just declining, it's collapsing. It is a multi-pronged global fertility destroying operation. Injections delivered by Big Pharma are only one of many means through which they are crippling the fertility of most human beings. Today, 20 million U.S. men are characterized as semen infertile. Millions more are described as semen subfertile. Poor sperm motility, rather than low sperm count, affects about 10% of infertile men. Thankfully, via proper exercise, hydration, breath work, and diet, we can render many of the toxins and artificial EMFs that are being weaponized against us inert/harmless once they enter the human body and flushing them out. The injectable genetic weapons are a different story, but they are avoidable. Also, for any of you that are saying, "You lying anti-vaxxer," overpopulation is a big problem, and we need to get rid of more dirty, polluting, cancerous humans to save the Earth. I will state the following. Even if our global population is increasing, and all the data I shared above is wrong, why do you choose to internalize the misanthropic propaganda of oligarchs that see you as an expendable peasant? As I stated in this post, humans are not born as an inevitable imposition on the biosphere. Our numbers on this planet could be a blessing rather than a curse if we just had the courage to dig deep and use our unique gifts to be in service of life. Instead of internalizing the false idea that portrays humans like a plague or a cancer on the earth, I advocate we instead use our free will and the sentience that so many humans covetously claim is unique to our species, to instead choose to define ourselves as co-creators of beauty, abundance, and diversity. A diet focused on ovogenesis, or egg development, can improve female reproductive health, and optimize fertility rates. Harvard researchers reviewed 8 years of food diaries from 17,000 plus women across the U.S., ages 25 to 42 years old, all with a history of infertility. They gave each woman a score based on how well she followed a specific healthy fertility diet. Long story short, women who scored the highest were 66% more likely to reverse their ovulatory infertility and have baby. It means that you have better chances of improving your ovulation through good foods that boost fertility naturally than if you were to spend tens of thousands of dollars on grueling medical procedures. What a man eats during the preconception stage is just as important as what the woman is eating, especially if you are experiencing fertility issues. There are specific nutrients men need, and here are some of the important reasons for men to eat a fertility-enhancing diet are: protecting and encourage healthy DNA. DNA is be passed on and will be responsible for creating half of your child, the other half being provided by the woman. Certain chemicals and nutritional deficiencies can damage DNA: smoking, pesticides, alcohol and chemicals, GMO food, and airborne toxins. Average male sperm counts are plummeting globally. Eating healthy foods that contain DNA-protecting antioxidants and nutrients can help to reverse the damage. In modern times, tests show an average of 80% of the sperm produced by a healthy male is DNA damaged. Much of this is from the ubiquitous radiation we are being dosed with by artificial EMFs. So be sure to look at this list of radioprotective, radiomitigative, and radiomodulatory whole foods and naturally occurring plant/fungal compounds to protect your DNA from that particular widespread source of DNA damage. Environmental factors, which can be difficult to manage, play a significant role in male infertility. Exposure to hormone-disrupting chemicals and plastics, artificial EMF-emitting electronics, food packaging, pesticides, big pharma drugs, and personal care products, like aluminium-laced deodorant, is directly linked to reduced sperm counts. These toxins can also lead to malformed sperm and decreased libido. Furthermore, rising rates of testicular and prostate cancers in younger men that have received mRNA injections, as well as an unprecedented increase in breast cancers among men, have been associated with these dangerous genetically polluting injections and hormonal disrupting toxins, like glyphosate. I think it is worth noting that while some MDs take the initiative to educate themselves about nutrition, the institutions that certify those professionals place their emphasis on synthetic pharmaceutical drug interventions rather than maintaining optimal health through preventative measures, using food as medicine. Many men and women asking their MDs about the topic of fertility will receive scant, if any, solid nutritional info, unless they happen to work with an exemplary individual that chose to learn about the importance of nutrition on their own. This was not always the case in the medical professional field. It was not too long ago that healthcare specialists would have emphasized the importance of whole food nutrition and herbs to support fertility, as opposed to surgical procedures and synthetic lab-made supplements/chemicals. As I explored in my article on the true nature of Big Pharma, it was around the turn of the century that the AMA, the Rockefeller Foundation, and the Carnegie Foundation forged their partnership and began to turn medical professionals away from preventative medicine and towards symptom-covering drugs. They put their money into drug-based research, oil-derived pharmaceuticals, and made that the main focus of healthcare, a move that turned healthcare into sickness management. The Rockefellers and other prominent banking elite, and the shareholders of their subsidiary pharmaceutical corporations, have been able to control and profit enormously from the drug industry. Now, all medical doctors in the USA are trained in medical schools that are run and/or accredited/sanctioned by the AMA. Of 129 medical schools in America, only 22 require even what amounts to basic rudimentary courses in nutrition. Medical students are not trained to see the connections between many degenerative diseases and malnutrition. Instead, they are taught only how to treat with surgical or pharmaceutical methods, but do not cure or alleviate the root problem or ailment. Similar numbers are reflected in medical education here in Canada. In this way, they are assured of lifelong customers. Surveys conclude that over 66% of all Americans regularly take prescription drugs, with only slightly lower numbers being reflected here in Canada as well. This is one of the reasons I felt compelled to put in the time to do this research and provide you all lists like these, as the people we were raised to trust with giving us health advice for important topics like fertility are, often through no fault of their own, often quite ignorant when it comes to this dynamic of human health. I hope this information below can serve to be helpful for both females and males working with their healthcare provider, whether they are allopathic MDs, homeopaths, nutritionists, and/or herbalists. I encourage people that are seeking to start a family and their healthcare providers to do their own homework. Do not take my word for it. Dig into the well over 100 references at the bottom of this post and confirm what I have shared here independently for yourselves.